Who's coming on. Welcome to our mental health symposium for Monday night. And once again, we're hosting Dr. Mark Browning, dealing with the subject of trauma. And we're expecting to go just a little deeper in the discussion tonight or in the presentation tonight. So as you come on, especially if you have teens around you or adolescents, young adults, just encourage them to perhaps go into their social media profile, or if they can hear from your speaker, to let them listen in. It's going to be about a 40 to a 45-minute discussion or presentation by Dr. Mark. So we won't hold you long tonight. And don't forget, we do have a deadline for you submitting your questions, and we're going to do our best to answer or have as many of those questions answered. So by the end of this week, I believe we're going to cut off the opportunity for you to submit questions. So as of Friday's broadcast, this Friday, you will need to have your questions submitted if, in fact, you want to make an attempt to have them answered on the final session, which is going to be committed to just the Q&A. And then we'll do our best also via email to make sure that the questions we can't answer, if there are resources available through a mental health entity, then we'll supply that for you as well. So at this time, so we don't prolong Dr. Mark's time, we're going to bring him on and let him begin to share. Make sure you share the broadcast once again and invite your family, followers, and friends to be a part of this. Dr. Mark, all yours. Thank you for being on tonight.
Thank you. Thank you. Blessings to everyone out there. Appreciate you jumping on again with us tonight. I pray that the information I share is a blessing to everyone who's listening out there. And please, if you have any questions, feel free to send those in, jot those down, and we'll try to get to them on that last Friday. So with that, I think I'll go ahead and get started. And I really tonight wanted to focus on the issue of trauma, trauma in and of itself, big T. So to do that, let's get into a little bit about what trauma is. First slide. What trauma really is an event that threatens the life or integrity of an individual or a loved one. That could be an issue such as physical abuse, death of a parent, witnessing of domestic violence, neglect, abandonment, war, natural disaster, anything that threatens our livelihood. It threatens us with physical harm, even potentially death, being maimed, or it can be emotional trauma that undermines our psychological functioning and well-being. We can take it down. It really has, particularly for children, the capacity to shape a child's physical, emotional, and developmental well-being. Trauma is that severe. It has the ability to alter actually the course of a person's life, depending on the intensity of the traumatic experience that someone experiences, or the prolonged experience of trauma. It could be not as intense, but happen day by day by day, or with frequency that really has the impact to get us stuck, particularly children, in the what we call the flight, fight, or freeze process. It's a natural process that's built into us to deal with threat when they come our way. And we'll talk about that a little bit more in depthly. But people who have experienced an intense traumatic event or prolonged experience of trauma, it really has the potential to undermine their relationships. It undermines the trust that we have for other people, our willingness to be connected, feeling threatened by other people that maybe aren't threatening. And we'll talk about that a little bit more as well. Basically, trauma, the experience of trauma, has the ability to overwhelm our coping capacity, our ability to deal with even day-to-day kind of routine experiences. Can be negatively impacted by the experience of a traumatic event or a series of traumatic events. It takes a toll on our long-term functioning, our ability to learn and take in information, our ability or our willingness to be engaged with other people or to avoid circumstances or situations for fear or threat. It's a normal protective response. When we are threatened, with physical harm or emotional harm, our bodies and our minds are built to respond in a way that serves as a self-protective measure. And that becomes an issue if it doesn't relent when the threat is over, or we experience threats so frequently that we have to continue to be on guard against those threats throughout our life. So, like the issue of anxiety, um, it is a natural response that we are built, well, that God built into us to be able to manage and cope with different circumstances. Um, but if it's prolonged, lasting, intense, it can really undermine our physical and emotional well-being. An example I was reading about recently was they likened it to the experience if you're walking on a path, say you're out in the woods or something along those lines, and not too far in front of you, a giant black bear crosses the path in front of you. Your natural response is going to be to freeze. Your muscles are going to tense. Your breathing's going to get shallow. You'll find it hard to breathe or hard to expand your chest. Your muscles will tighten. Your senses will be heightened. Your pupils widen to take in more information. Your muscles infuse with blood to be able to allow you to run or respond. You hear things more sensitively. It's a natural response to the threat. So the black bear, let's say, crosses the path and goes off into the woods. You continue forward on that path, still afraid, still anxious, still on high alert. You pass that area and you maybe run to get away from it. But once you get to what you feel like is a safe distance, then your body starts to relax. Your heart rate starts to slow down. Your The narrowing of your vision starts to broaden for you to take in more information. Your muscles start to relax. You start to breathe more easily, and that's our body, our autonomic nervous system returning to an equilibrium or taking us back to that space where we feel can feel comfortable and less intimidated or threatened. Um, so trauma, if you can imagine. Feeling like that black bear is always around for children and adolescents who have experienced traumatic events. That's what it feels like, that black bear is always right around the corner, or that black bear. I can't close my eyes when I sleep because there's the potential that bear is going to show up, or I'm preoccupied during the day by that bear. It's all I really think about. I can't concentrate on school. I can't concentrate on conversations. That's kind of what the experience of trauma can be like for people who've experienced an intense or prolonged trauma. So we're going to talk a little bit about that and how it undermines our ability to function. Next slide, please. So there's a study years ago that was done by, I believe, Kaiser Permanente and the CDC. And what it wanted to evaluate was the relationship between childhood trauma and health outcomes in later life. And so what it really consisted of, and you can find the adverse childhood experiences screening, or the ACE screening. You can find it on the internet. It's pretty easy to find. But what it does is it has 10 questions regarding a person's exposure to abuse, neglect, to household threats, experiencing domestic violence or observing domestic violence, um, uh, having a parent or a family member with a mental illness, issues of substance abuse in the home, kind of some fundamental kinds of experiences that have been deemed to be traumatic for children, physical abuse, sexual abuse, things of that nature. And interestingly, the findings. Now, the initial test was done with, I think it was about 17,000, primarily middle class Caucasian participants, but it's been replicated in a number of different environments, different cultural environments, and um, different urban environments versus suburban environments and things like that. But what it found interestingly is that most everyone who participated experienced at least one ACE, or one adverse childhood experience. But for those who experienced, but the great majority of those participants experienced two or more adverse childhood experiences. And those that they found with multiple experiences across a broad range, if they experience neglect and abuse, or abuse and household dysfunction like domestic violence, or a parent who suffered from a mental illness, those participants were much higher likelihood of a risk for health problems. Not only health problems, those who had 6 or more ACEs were at high risk for emotional health problems, for physical health problems, and premature demise, as many as 19, 20 years earlier than life expectancy for whatever their group was, male or female. So it is an indication that trauma can actually take years off of your life. And prolonged exposure to trauma was very, very difficult, particularly for children. Children's minds are malleable, and they're forming, and they're building new pathways and the ability to take in new information, which on the positive side is very beneficial, obviously, for children, because it assists them in taking in new information. It assists them in learning coping skills. It assists them in being resilient and rebounding and coming back from difficult circumstances. But on the other side, because those neurons are so young and tender and new, intense trauma can have a profoundly negative impact. It can undermine learning and socialization, the ability or the willingness to connect with other people. Hyperarousal that sometimes comes with traumatic experiences, that experience of being on alert the majority of the time, can have the impact of causing us to overreact to situations, one, but to respond with excessive reactions to circumstances that are non-threatening. So we get overreactions from children or adolescents if they experience trauma to more benign sort of situations. I kind of think of it a little bit like like if you ever had a toothache or an open nerve. Everything hurts, even benign things like air passing through your mouth, or your tongue brushing up against it, or water, or cold water, or lukewarm water. Because that nerve is open, it causes really intense pain and intense response and reaction. And that's the kind of the way that we can be if we've experienced really traumatic experiences. Even some have spoken about, particularly in survivors of sexual abuse, have talked about the experience of what we call dissociation, which is when we actually have the experience of sort of disconnecting from our body, like whatever it is that's taking place is happening to someone else, and we're sort of transported outside of our body, viewing what it is that's taking place. It's a coping mechanism that allows trauma victims to disengage emotionally and diminish the emotional impact of what it is that might be happening to them at any point in time. So the traumatic experiences have a profound effect on us. And the earlier in life they take place, and the more consistently in life they take place, the more detrimental the experiences obviously can be. So let's touch a little bit on the effects of those traumas that we can experience. Next slide, please. Trauma can be caused by, one-time events such as accident, injury, the experience of violence or being accosted, robbed, ongoing or relentless stress, such as living in high crime neighborhoods, experiencing significant illness, bullying, domestic violence, things like that, things that are ongoing and persistent in our lives, or even overlooked causes. I think some of the things that we overlook is maybe participation in a significant surgery, even though that was something that we experienced for our own health and well-being. The experience of being in the hospital, the experience of of putting yourself in someone else's hands. The experience of the surgery, the actual surgery, and the recovery that takes place um, can have a profound impact on us. Things like the loss of a loved one, death of someone close to us, even things as significant as a move from a place that we've felt safe, can be a traumatic experience. We all are different. We all have different capacities. We have different tolerances for different kinds of experience. So trauma is likely not going to affect the same person in the same way every time, even though there is some consistency with people who experience certain types of trauma, like sexual abuse or domestic violence, um, or have been violated in some way, they've been robbed, or accosted or beaten, something along those lines. There are similarities, but every one of us has different capacities and are likely going to respond to those things differently. And also, we'll talk about a little bit about what we call protective factors that also help us respond um, more effectively to traumatic experiences. But some of the normal responses, um, before I say that, I want to say I want people to understand that if you have had a traumatic experience and you experience some of the things that we're talking about, I want people to understand um, that in some respect these are normal reactions to abnormal situations. So um, being mistreated, being hurt, being taken advantage of, are are um, are not normal ways that we're supposed to function, or normal types of things that we're supposed to deal with. But our mind and our body not only has to try to make sense of what it is that's taking place, we're going to respond in a protective manner. So many of the reactions that I'm going to talk about now, just some of the emotional and psychological reactions, and some of the physical reactions, are natural responses of our body to being under threat or put in circumstances or situations in which we could potentially be harmed or killed or injured significantly. So some of the emotional or psychological effects that we might see or responses are shock and disbelief, or even denial that something has happened to us. Um, we might experience confusion or difficulty concentrating, a difficulty paying attention and taking in information even when it's important. We'll experience anger, irritability, even mood swings will be a natural part of the way that we respond. Obviously, anxiety and fear. There's excessive worry or concern, or anticipation of harm that comes oftentimes as a result of trauma. We may feel guilt or shame or self blame. It's not unusual for us to sometimes blame ourselves, like there's something we should have done differently, or how come we didn't see that coming, or what other steps should I have taken? If I had it to do over again, I would have done this and that wouldn't have happened to me, which is all very challenging because whatever we do is the best thing that we're doing in that situation, given the circumstances. Withdrawing from others, isolating, just not wanting to be around or connected with other people, feeling sad, a sense of sadness or hopelessness, or feeling disconnected or numb. Many times, people who have been subjected to trauma will feel numb as a way of using sort of an emotional anesthetic to whatever it is that we're experiencing. So it kind of numbs the emotional pain or the physical pain of what we experienced. From a physical or physiological standpoint, we might experience, no, we're likely to experience insomnia and nightmares, being startled easily, having a jumpiness, not being able to be at ease, difficulty concentrating. Our heart may race. What we call tachycardia, where there may be an edginess or an agitation to us, a restlessness in which we can't be still, or we always on alerts. We can experience aches and pains. Oftentimes, sometimes when we suppress kind of emotional challenges or difficulties that we experience, that those things manifest in physical discomforts. I think we talked about this a little bit in one of the earlier sessions, that it may show up in GI distress or stomach upset, many times headaches or various kinds of aches and pains, rigidity in our limbs, things of that nature might show up as manifestations of that trauma, muscle tension, things of that nature, which can precipitate headaches. So there are a lot of physiological and emotional responses that we have to traumatic experiences. For children, the reactions can be somewhat different. Sometimes in small children, what we'll see is a regression to an earlier age. So maybe you have a child who's 7 or 8 years old who has experienced some kind of a traumatic event. Oftentimes they will regress to an earlier age, an age of security and safety, maybe an age of 4 or 3, when they felt safe. So they may act or at a developmentally younger age, and that's sometimes an indication that something traumatic has taken place with that child. The children oftentimes will think it's their fault, that they had somehow brought this experience onto themselves in some way, shape, or form. They don't have sort of maybe the cognitive ability to obviously to understand, and oftentimes children take on more responsibility than they should for things that maybe take place in the household that obviously aren't their fault. So we may see that in children. It'll show up in sleep disorders, either inability to sleep or inability to stay asleep, or wanting to stay with parents versus sleeping in their own room. Um, Nightmares or night terrors, things of that nature, can be an indication that something's wrong, or feeling a sense of helplessness, and like they can't do anything for themselves, even though they may be developmentally able. So it shows up differently, obviously, in children than it does in adults. And children, it will likely show up more physically or acted out in their behavior, because they don't have the ability to articulate maybe what it is that's taking place with them. Next slide, please. So as I had indicated a little bit earlier, there can be some profound medical, physiological effects to trauma beyond some of the symptomology that we just talked about. Childhood trauma puts us at risk for psychiatric disorders like depression and anxiety and post-traumatic stress disorder, as well as a host of other medical problems such as cardiovascular disease, cancer, obesity, things of that nature. Some of the behavioral changes that we engage in are actually sometimes coping mechanisms to be able to manage the distress that we've experienced related to a traumatic event or a series of traumatic events. For instance, the issue of alcohol and substance abuse. Alcohol is a depressant, and it can serve as a form of anesthetic for people who are going through emotional pain. So it's not unusual for people who experience a traumatic event to maybe turn to drugs and alcohol, either as an escape from the imaging or the thinking about or the preoccupation with what's taking place, but to numb themselves from the pain of what might have taken place. Overeating is sometimes a response that people have to a traumatic event. Food, particularly comfort foods, tap into the pleasure centers of the brain and have the ability to create kind of a self-soothing feeling or self-soothing circumstance. So sometimes the overeating and sometimes the weight gain that comes with it can be in a response to traumatic event or traumatic events. Engaging in other high risk behaviors. Sometimes people engage in reckless behavior, criminal behavior, antisocial types behaviors, are maybe overly affectionate with people, sexual indiscretion, things of that nature also can sometimes serve as an escape uh, for negative emotions, but also a way sometimes of people attempting to gain control over what it is that took place in their life. But they're all kind of ways of us coping with the things that we've experienced. Dr. Roberts of the Harvard School of Public Health indicated that behaviors are sometimes used as a coping mechanism, a way of dealing with the emotional dysregulation that occurs when someone has been traumatized. So we'll find that there are unique ways that sometimes without help, that we try to manage ourselves and manage our own emotional control over the thing that's impacted our lives so significantly. Um, in regards to sort of physical effects of trauma, um, uh, as I kind of talked a little bit about in the black bear example, um, our parasympathetic nervous system responds to threat, and so things take place with our hormones in our body that activate different areas, different muscles, different uh, means of coping with that stress. And obviously, they are useful to deal with threat. They allow us to move more quickly. They allow us to be stronger to ward off threat. It increases our reaction time. However, if that system is rarely shut off, or rarely ever, if ever, shut off, or is kept at a high level for prolonged periods of time, it's like revving your engine at high IPMs over the course of a long period of time. That would create wear and tear on an engine. And just as there's wear and tear that's placed on an engine in that situation, wear and tear is placed on our body internally, on our organs. The cortisol that is useful in helping us ward off threat, if coursing through our system and our bloodstream for long periods of time, has a negative impact on our organs and our organ functioning. It can lead to obviously cardiovascular disease, um, the potential for stroke rises. It can precipitate the effects of type 2 diabetes and the mismanagement of insulin within our body. It can lead to things like liver disease and other kinds of negative impacts, such as autoimmune disease, which can be obviously detrimental and is likely one of those things that can precipitate, obviously, premature demise in adults who have lived with this kind of stress over long periods of time without, worthwhile attention to those issues. Typically, the more trauma that we experience, the worse our health outcomes are. So this is a profound issue that we have to cope with. Um, and we touched in the beginning on sort of an overview of mental illness and mental health concerns, such as depression and the bipolar disorders and anxieties and things like that. So trauma um, has the potential to manifest in any one or all of those ways. That's part of the reason I wanted to address those things early, because what we're seeing um, in people might not be exclusively related to a depressive disorder or an anxiety disorder, but may be more a manifestation of the trauma that people are experiencing. Obviously, we live in very difficult times and always have lived in difficult times. It's interesting. One of the things that I used to be involved in, I worked as a liaison for an adult drug program in one of the counties near me. And for those who aren't familiar, drug court programs or mental health court programs are opportunities for those who have committed crimes to have an opportunity to get assistance through the court system. So, in a nutshell, if the person is agreeable to this type of care, they have to report to court every week. They have a public defender. but they have to be involved in treatment. They have to be involved in a treatment program and successfully complete a treatment program. They need to be in some kind of supportive system, like if it's an alcohol use or abuse, in an AA program, have a sponsor, things along those lines. Um, eh, but they're sort of bracketed with supports by a team of probation officers, mental health personnel, treatment personnel, things of that nature. What was interesting was that I had to do psychological assessments for as part of this being on this team, the drug court, and so many of the people who were involved in the drug court, whether it, even though their primary purpose for entering was substance abuse, in doing the evaluation, trauma was almost always at the heart of their concern, either childhood trauma, uh, history of sexual abuse for women and men, abuse of adolescence, in adolescence, of bullying, or involvement in crime, or mistreatment by gangs, or living under threat. And it was an indication to me uh, how pervasive and far-reaching the issue of trauma is, and the impact that it's having on people's lives. And obviously, we need to consider issues like intergenerational trauma, in which family members are replicating harm on other family members that was maybe perpetrated against them, uh, either in their youth or somewhere along the lines. Interestingly, my wife and I were watching Whitney. We were watching a documentary on Whitney Houston this past weekend, and the obviously I don't want to paint with too broad a brush, but the issue of sexual abuse and sexual trauma by a family member, and the impact that could have, likely did have, on her overall health and well-being, and the ways she just responded, and ultimately her demise. It makes me really wonder how much of a prevailing impact they had on her, on the outcome of her life. Someone who was very gifted and very talented, very blessed, just seemed to really be able to have the world in the palm of her hands. So it was just a reminder to me of the impact that trauma has on people's lives, and obviously the impact of unaddressed or not effectively treated trauma over the course of a person's life. Next slide, please. So when we think about trauma, particularly childhood trauma, I think we can, if we think about it a little more in depthly, we can maybe understand the complexities of it, and how how and why it potentially has such an incredible impact on people throughout the course of their lifespan. Um, if you think about it, children are dependent on their caregivers for survival. They don't have the ability to report things that are happening to them. They can't move away. They can't protect themselves. So the helplessness that it's involved in childhood trauma has the potential, obviously, to shape how we feel about ourselves, our sense of value, our sense of worth, how we feel about our caregivers, how our caregivers feel about us. Um, are they there to protect us? Are they there for their own? Are we there for their own selfish means, or are we here because they love us and desire to take care of us? Sometimes it's a means of, our response as children can be a means of survival within the family. You know, acquiescence to the things that take place and happen to us. Um, in some respects, is the way to keep us alive, or keep us safe. Not that we want for anything to happen to us, but if we are concerned not only about our own well-being, but of the well-being of other family members, we children may do things that are against their best interest in order to keep them safe. Um, it, 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 it can promote secret keeping as well, which can be tremendously damaging. But children don't want negative things to happen to their parents. They don't want oftentimes to be exposed themselves, to acknowledge that certain things are happening to them, or acknowledge to others that certain things are taking place in their family that are detrimental to them and others. It creates a very distorted understanding of attachments. Attachments being our connection to loved ones, secure attachments being attachments in which people are trustworthy to take care of our welfare, well-being, and security, where we're being shown appropriate levels of affection and being shown that we are loved and cared for. Um, if we are being taken advantage of, mistreated, harmed, uh, abused by those who are responsible for our care, um, that can't help but distort the way we see the rest of the world. If the person who is responsible for taking care of us is the one also abusing us, how are we supposed to uh, expect better treatment in the outside world by people who maybe don't know us, don't have responsibility for us? It can create a sense of feeling a need to be on guard at all times, or to be self-protected, or to be aggressive to keep people at a distance, or to detach or disengage entirely because people can't be trusted. Um, Children don't have the ability to integrate and process, what it is that's taking place to them. Um, so there are a few things that are more detrimental, uh, particularly to a child's life, but ongoing individual's life, other than trauma. I think we talked a little bit about signs and symptoms of trauma in children, so I won't necessarily go over those again. But in looking at adolescents, um, because they're in that space between their ability to sort of cognitively express what it is that's taking place to them and the emotionality that's involved in childhood. Um, Adolescents who have experienced symptoms, experienced traumatic events, also will carry that out more behaviorally, and that can be seen sometimes in a loss of interest in enjoyable activities, things that they would generally be involved in that they just discard and don't really want to have anything to do with. That can include people as well. Low energy. I mean, it is uncommon for an adolescent uh, to not be vibrant and enthusiastic and excitable and active. So if we're seeing that an adolescent is experiencing low energy, dysphoria, lack of motivation to engage in things that may some kinds of traumatic events, sleeping excessively, or not needing sleep at all. It's interesting how much our sleep is an indication of what might be taking place with us. I mean, even when we're stressed, we probably don't sleep as well because unconsciously our mind is active. Um, but if we can't relax to the point where we can sleep peacefully throughout the night, that may be an indication that there are some things going on that need our attention. Isolation and avoidance of social activities. The adolescents are social animals. There's much more emphasis on the relationship with peers than there are with maybe friends or family member. If they are detaching from that and disengage from that, take no interest in peers or social activities, then issues of self-injury, like cutting oneself or burning oneself, beyond the kind of cumbersome um, uh, 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 adolescent accidents. If we find someone who is more accident prone and is coming home with a lot of injuries there and putting themselves in a position to be injured. If smoking, drinking, substance abuse are generally always an indication that something is amiss. Doesn't necessarily mean trauma, but is usually an indication that there are some things that would uh, that we maybe need to attend to as parents. Risky or self-destructive behavior, being engaged in reckless kinds of behavior, taking excessive amounts of risk beyond what is customary sometimes from adolescent experimentation. Obviously, we have to kind of balance these or gauge them. But then obviously thoughts of suicide, feelings of not wanting to live, actively putting themselves in a position to be harmed. Those are all obviously concerns that need to be addressed or our attention, need our attention. But if you think about it, for adults, it's hard enough for us as adults to make sense of maybe some of the experiences that we've had throughout our lives. Um, why things happened to us? Was there things that we could do differently? Why didn't we do things differently? Um, what's wrong with people that they would mistreat me in such a way? If we as adults have a difficult time sort of making sense out of that and then responding appropriately or effectively, how much more will that be the case for adolescents and for children? Next slide, please. So in thinking about this, has been kind of a high level view of trauma. So I want to, as Apostle said, you can go back if you'd like and look at this again, and because I know there's some information on the slides that might be useful. But quickly, in looking at some strategies, I think it's one of the most important things, whether it be for children, adults, or adolescents, is a thorough screening and assessment, which can be done with a licensed clinical psychologist. Reason being, I had mentioned before, diagnosis and how important that is. So we want to make sure that we're treating the right thing. Yes, someone may, in a cursory assessment, come away with a diagnosis of depression. But if the issue is trauma, we want to ensure that we're directing any treatment approaches to the issue at hand. Because if we're just dealing with the depression and the issue is actually trauma or traumatic experiences, then we're really just putting a Band-Aid on what the actual issue is. When we're looking for care, we want to look for trauma-informed care. What that means is that, in a nutshell, trauma-informed care is taking in not just the symptomology and what's taking place with the patient from a symptom standpoint, but also their home life, their holistic life experience, their school and academic experience, relational experiences, work backgrounds. We want to look at all of those things to make sure that we are correctly identifying where the issues of impact are taking place. With children, we want to use resources like play therapy. Play is children's work. What's taking place in their life will be expressed through them in their play. For adolescents, we want to use a combination of psychotherapy, but also experiential types of therapy, music-related therapy, art-related therapy, things that are physically active and engaged in problem solving. Adolescents they need to be more active, and oftentimes they express themselves through their problem solving and activity better than they can articulate that. So those things need to be kept in mind. And then the family therapy, I think, is an important component as well. If someone is experiencing a trauma, PTSD, or traumatic responses to traumatic events, it's not exclusively their problem. This has taken place in the context of a family or a community. And not only does that community need to be educated about what's taking place with that person, but also that person needs the support of those individuals who are close to them, because secure and worthwhile attachments are one of the keys to people being able to cope and effectively come out of traumatic experiences or grow or develop in a way to reach or maximize their potential. For adults, obviously it's assessment as well, and make sure that we're on point in regards to what we're addressing. But we want to do things like exercise and avoid isolation, work on our self-regulation skills, being able to self-soothe through meditation, through prayer, through yoga, through Tai Chi, things of that nature that help us get our emotions or manage our emotions more effectively. And obviously good self-care and diet and sleep. stress reduction activities. How do we reduce the stress in our lives? How do we avoid alcohol and drugs and find more effective ways of managing the stress that we experience? All those things are very important. And then on this slide, I had some resources of some sites that are really can really be beneficial, like Lurie's Children's Hospital in Chicago, for helping to address, assess, screen, and get treatment for children's issues. SAMHSA, the Substance Abuse and Mental Health Services Agency, it has some very good resources. They have treatment locators that will help us find services in our area, trauma informed services in our area that we might be able to utilize. And then from an education standpoint, places like the International Society for Traumatic Stress or the National Center for PTSD. We can go to those websites. There's lots of useful information on understanding trauma, understanding the effects of trauma, different types of trauma related care, which would all be beneficial. So with that, I think I don't want to overrun my time. So I think I'll kick it back to Apostle Elvis to close out. Thank you for listening again.
All right. Oh, wow. I was trying to capture as much of it as I could. And normally when I hear information that's coming from a certain realm of expertise, I try to process it through my measure. And I thought about the first traumatic experience that humanity within the biblical narrative experience was through a couple, Adam and Eve. Their breach of connectivity or the covenant with God led to a traumatic expulsion from the Garden of Eden. And then they get into this territory, they bear a son, and then they're left really in the aftermath of their personal indiscretions. But you can see the transference of it within their seed, especially the first generation. There was a murderous spirit. I'm using spiritual terminology, but in Cain and his issues with the trauma that was transferred upon him, where he had problems within his identity. There was obviously an esteem issue. He had an anger and rage issue to the point where you could become so incensed you could kill your own sibling over something as trivial as an offering. Yes. And it led to him living a grossly unstable life. There was a measure of paranoia. He tells God, everywhere I go, folk are going to kill me. It's like, how many times can you be killed, Cain? You can only be killed once. And he was a vagabond. He had no roots. His life was totally unstable. And then there's another guy named Jephthah mentioned in the book of Judges. Jephthah was called by God as a mighty man of valor, Judges chapter 11. But he was the son of a harlot. He lived in a household with his father, who was married to another woman, and there was a set of children by her. Can you imagine the verbal abuse that Jephthah experienced on a day-to-day basis, to the point where he left and they had a need for his physical prowess, and he makes an ill-advised vow to God that whoever comes out of his house first, he would sacrifice to God, because there was obviously no infrastructure for family value working in him, that this is your household. You have no idea who's going to come out. Why would you take a risk like that? So we talked about like risky behavior. And then Paul wrote a letter to the Church of Corinth. They had a lot of morality issues going on. And in 1 Corinthians 13, this is the term we use when praying for people who are experiencing growth impediments for issues consistent with injuries, albeit emotional or psychological. We call it arrested development. And he says, when I was a child, I spake, I understood, and I behaved as a child. But now that I become a man, I put away childish things. And how trauma will arrest the development, as you articulate, of a person, especially in children, where if they're like adolescent stage, they'll go back to behaving.
Regression.
Yeah, the regression because of the traumatic experience that has put them in some type of anguish. And I'm like, wow, this is a lot.
Yeah.
A lot. And think about the number of people, like you talked about, some of the ways in which trauma can occur: an accident, an invasive surgical procedure, the loss of a loved one, you're the victim of a crime, and and how, depending on how you're wired psychologically yourself, those incidents can have different effects on you as a person.
Yes.
I think it's so important to not to have the natural scientific aspect of it as well, because it'll help us with just certain behaviors we probably not paying attention to, and then to have that devotion, so you can grow spiritually beyond that
Yes.
limitation. This was very, very good, very good.
Well, thank you. And that attachment, first and foremost, should be to Christ. We
Yes,
have a loving Father who that's where our identity should come from,
yes,
and that's who He's our protector and our security and our guide.
yeah,
And I think when we have that attachment, if we have that attachment with Christ, and we can have that attachment with other caregivers, loved ones, I think that goes a long way in helping us develop out of that stagnation that you're talking about.
yes, yes. All right. Well, thank you so much for your time. I know you
Yeah.
probably had a long day within your sphere of influence. So great grace be unto you, Dr. Mark. We appreciate you. And
You.
thank you so much just for adding to this specific platform with the level of expertise that you carry. Looking forward to the few remaining sessions that we have. I can't believe we're already halfway done. And
Have a good one.
it'll be a wrap. Yeah, yep. So everyone, thank you for your time this evening. And Dr. Mark, we will see you on Friday.
Appreciate you. See you on
Okay.
Friday.
Appreciate you.
All
Okay.
right.
God bless. Okay.
Blessings.